Mapping the Future is a project to create a future picture of the modern, efficient health and social care services needed in West Kent. Over the summer of 2013, NHS West Kent Clinical Commissioning Group held events to find out what people think is needed.
It appears from what we've been discussing today that we need to take some radical changes to the system to make sure there's more an integrated service.
I personally think that the key to their success is being able to keep the organisational wrappers off until the last minute. So design a care pathway, a gold standard care pathway with patients at its heart in order that we can then implement.
At each event, local doctors, health and care professionals, voluntary organisations and patient representatives discussed how services work currently and how things could be improved.
I think because we are finally coming together, and I think because we come together with so many organisations, this is probably the first time. I think we're talking better to each other.
Looking at all of the kind of service development maps that people have produced, there was a lot of consistency. That fills me with hope, really, that we're actually already going in the right direction, and there's some consensus around what needs to be done.
The topics discussed at all of these events were selected because demand for these services is expected to increase over the coming years. Even though different topics were discussed, some common themes were identified at all of the events. Information gathered from the themed events was pulled together into a Mapping the Future blueprint or plan, setting out how health and social care services could potentially be delivered going forward in West Kent. A final wrap-up event took place at the end of June. This meeting provided an opportunity for everyone involved with the previous themed events to comment on the draft blueprint.
There has to be ways that collaboration is the golden thread in all of this, and that we come up with systems and processes that allow us to make the change actually happen.
So we've been part of this project from the start, and we see this as a very natural part of the work that the Health and Wellbeing Board is doing, which is all of us working together much better than we have in the past.
It's brought together a number of organisations and the public to talk about what we need to do differently for the future.
I think it's absolutely great. It's absolutely what should be happening, and really looking at the future and having some long-term goals as well as dealing with some of the short-term issues.
I'm impressed by the approach that's been taken. It's essential to get to grips with the future in the way that's being done here, and the inclusive nature of the project is very healthy.
Working in this way, a very new and different way, has been fantastic.